Welcome, dear viewers, to today's episode of Visite. And thank you for being here. And thank you for the letters you have sent me. And I have selected an email which the children sent me. Their father is currently in hospital due to severe headaches. Now, varicella zoster, a viral disease, was found in the liquor, and it was stated as the cause of the headache. One is of the opinion that an additional Lyme disease is not the case. However, the children point out that in the past, Lyme disease was diagnosed by an increased LTT finding. LTT is the so-called lymphocyte transformation test. It is now planned to give an infusion of pantazole 20 milligrams 3 times a day for 1 hour and 750 milligrams of acyclovir in 500 millilitres of NaCl. And this form of treatment is an antiviral treatment. However, there is a risk of kidney failure, and the father refused this form of treatment. And now the question of the son, that he now, of course, has a very strong pain problem. In addition, the kidneys were already damaged by Zyklon B due to the father being on duty as a firefighter and experiencing a very toxic load for years, and has been suffering from joint pain and inflammation of the scalp, dizziness, and migraines for a long time. The question for me now is, how do you rate it overall? And I think the point here is not to evaluate something that is now symptomatically being dealt with, but rather a general understanding of these things. I have also taken up this request because at the moment we are observing the overall situation, and it becomes very clear, and America is really pioneering, that there were very strong varicella zoster, shingles reactivation diseases. And the time we are experiencing at the moment is predestined to provoke a development of this viral reactivation. And I want to take that as an opportunity to decrease this number. Lyme disease is a bacterial disease. The frequency of Lyme disease today is like syphilis 150 years ago. So today, not to become infected with spirochetes, with Borrelia, is hardly possible anymore. But an infection with such bacteria and a disease resulting from it does not solely depend on whether I am infected or not. And I feel the need to make that clear to you again. Because today we are, of course, dealing with illnesses, and especially neurological diseases. And here I don't just mean headaches or migraines, but I also mean meningitis. I also mean this hyperactivity. I also mean Parkinson's disease, multiple sclerosis, amyotrophic lateral sclerosis, and all forms of neurodegenerative diseases. Always have a multi-causal process. That means it's not just about recognizing viral reactivation now, but also simply to judge that we are also dealing with autism in children. We say today, in 2025, every 3rd or 4th boy will be an autistic boy. Because the questions of androgens, testosterone, have a negative synergistic effect with many additional environmental toxic loads. But I want to come back because the expansion of these neurological diseases is, and get this, it increased by 663% over the last 20 to 25 years in America, with an upward trend, and in Europe too. And that is why a multi-causal view is also needed, to the point of view of the creation and the triggering of all these things. Today we know about latent cyanide poisoning from hydrocyanic acid through exposure as a firefighter. But we also know about many other physical stressors, but also psychological. Do not underestimate. If you are in financial distress, if you have experienced trauma, if you live in fear, please do not underestimate what an incredible burden we have today via the atmosphere, via the air, the high aluminium load, the high herbicides, pesticides, organophosphates. It all causes an osmotic imbalance, as you can call it. This in turn has an impact on the detoxification metabolism in us. There are millions of enzymatic pumps involved every day, 24 hours a day, 365 days a year, to eliminate toxicity from our bodies. And mucous membranes are our entry points for all these things. And therefore, an event that triggers a disease influences whether that is Lyme disease, that there is there in the depths, but perhaps we are not yet able to diagnose it, or there are no classic symptoms in any form yet, because very often it's like that we only look for Lyme disease when we maybe just got a tick bite. But the tick is just one of 400 different ways to get in touch with these spirochetes. And the human organism today is partially such a weakened organism. On the one hand, evolution has also made it very strong, but on the other hand, due to the multi-causality of life, it is an organism that does not always provide the appropriate immune defense. And that's why it's so important to consider this multi-causality. Also at the beginning of a positive liquor finding of herpes zoster. And of course, there is no way around it. Of course, you have to act here, but you have to clarify the questions. What has happened in the course of life that such a dramatic reactivation has now taken place? And this variety of individuals, and everyone has to evaluate their own life and do research with a great deal of personal responsibility. What is normal for me? What is my diet? What is my lifestyle like? Do I exercise? Do I not exercise? Am I constantly in fear? Am I in hypoxia? Am I constantly starved of oxygen? Am I stressed in my lifestyle? And so on. All of this has an influence on a viral reactivated event. And the Borrelia, and that's why I come back to it, we might be able to see them in dark field microscopy through special staining methods. We can today identify forms of spirochetes. This is an incredible development that dark field microscopy has also made in recent years, to diagnose these things there rather than through an indirect immunoassay. Because the lymphocyte transformation test only shows to what extent the high activity of the lymphocytes is available to deal with Borrelia. This means a value that is not dramatically increased does not mean that I also have a dramatically increased spirochete load. I may have slowly gotten into an immunological exhaustion. This means that if my body can no longer cope with the Borrelia, and on the other hand a clinical picture naturally triggers itself, then it is even less able to cope with the reactivation of the viruses. And, for example, I don't know any patients with Lyme disease who do not have viral co-infections in the background. And we see that. For example, we see the co-infections. These are opportunistic germs. Let's say that the Borrelia led to reactivation of herpes viruses 1 and 2, herpes zoster, herpes simplex, always the cold sore, the cytomegalovirus, but also Epstein-Barr virus. And if you clinically examine an Epstein-Barr virus disease, then I can tell if I have a persistent Epstein-Barr reactivation that we're talking about. Do we maybe have an Epstein-Barr strain, but the body is wonderfully in control within the scope of its possibilities? Or are there always reactivations? And when are reactivations? Reactivations always happen when intracellular immunity is not at 100%. Lyme disease itself becomes a real problem. If the only therapy for this Lyme disease is, of course, with an antibiotic, and I often experience people dealing for weeks and months with an antibiotic to really eradicate the forms of spirochetes in the acute state. That is out of the question, but the late effects are altered spirochete forms, the doubled cyst forms, or the cell wall free L forms. This means for decades now there has been a chronological, continuous, sometimes symptomless survival of such bacteria. There was an infect drug resistance study there in 2011 that has again proven this. That these cell wall free forms, also certain other spirochete forms, actually adapt to a very strong antibiotic in their survival strategy and transformation. And of course are fighting for survival, fighting for their own survival. And please do not underestimate that any antibiotics also affect our intracellular energy output. And of course, these are things that are very important at the moment, also in the general context of our energy performance deficits. But when I talk about Borrelia and co-infections and opportunistic germs, then in that moment you also have to mention other virus xenotypes. These are so-called XMR virus infections. And with these xenotropic mouse viruses, there was a study of 101 patients with chronic fatigue, so severe fatigue exhaustion and fatigue syndrome. 68 of these patients have been burdened with this particular form of viral reactivation. That said, there are serious viral loads that we also see in the development of prostate cancer. There are also other retroviruses. These are RNA viruses, incorporate into the normal genome of the human cell as a matrix, and then get reproduced as viral DNA workers. The whole virus reactivation and also the use that these cellular structures have in our cells, this is a new area of research within the last few years. And I think we're going to find out and experience a lot more about that. But what we clearly reject from the outset as biological doctors, that a virus and the positive properties that a virus exerts in the cell, this is research work, but it does not become a problem if the problem cannot be found and sought in an organism. And I'll come back from Lyme disease to the herpes zoster disease, because a herpes zoster disease is always a look at an organism that is already suffering from an immune deficiency. And every person who also has a herpes simplex infection again and again, perhaps due to strong exposure to the sun, or a small zoster appears on the buttocks again and again, or always at large intervals. And these patient stories, which one hears every day, show that herpes reactivations occur again and again. When they couple and when the body's compensation to face a virus with an appropriate immune strength suddenly no longer exists. And it is the same here. So to get a virus out of reactivation, the acyclovir is a form which is, of course, aimed specifically at the virus, but fails to take into account that the cause is weak immunity. And maybe you can think of it as, I always think biological medicine is so logical. Maybe you can imagine that even we humans, we don't have an infinite amount of immune activity. But when this entire immune activity has been burdened with an incredible number of everyday things for a long time, and on the other hand, now there is a difficult fate in the family, or now there is another fire brigade operation with a highly toxic load, then at some point the body's own compensation will come to an end. And this is where therapy starts. Vitamin C now in high doses. And there's no point in taking high doses of vitamin C in an oral form of about 200 or 2,000 milligrams. That would be 2 grams. This immediately gives the innate immunity the go-ahead to become active. This is now also a very high form of stimulating the leukocytes, the first line of defense, in dealing with bacterial viral processes. It also stimulates T lymphocytes. Now, of course, it helps to scavenge free radicals. It helps in the context of the entire collagen synthesis, the vascular situation, you know all that, but the most important thing is that you do a high-dose vitamin C substitution. At best, IV, because you can get up to 7 grams of vitamin C, or 10 or 20 or 30, depending on the extent to which it is also possible for you within the framework of a complementary doctor or naturopath. The important thing is that if you go over 10, 20 grams, please have the enzyme glucose 6-phosphate dehydrogenase measured so you don't get kidney stones. It is important that the kidneys remain well able to excrete here as well. But this high dose of vitamin C, and in small doses, if you take it orally, the body would actually excrete the excessive vitamin C. Take it in small doses, 200 milligrams, or buffered with 500 milligrams, and then after a few hours, 500 again, maybe 4 times a day. This means that this depot effect is constantly releasing the vitamin C. This is important. Another thing, always remember that the cell intracellularly needs zinc. And zinc is one of the most important trace elements for hundreds of enzymes. Enzymes are the ones that keep the detox pumps going as well. Enzymes are those that also provide immunity intracellularly. And without zinc, intracellular immunity cannot keep a virus in reactivity. That means, for many things, the immune balance, the metabolism, detoxification, maintaining the health of the hair, eyes, nails, mucous membranes. Zinc is always necessary. In the case of zinc, it is important to combine with vitamin C because vitamin C makes it easier for us to absorb zinc. Only part of the oral substitution is taken up. They say a maximum of 10 to 20%. It is therefore important to take zinc several times throughout the day. Zinc is freely available in 15 milligrams, which you can then take 3 or 4 times a day, especially in acute situations. Maybe have the zinc level checked from time to time. But please in whole blood, because zinc is not in the plasma, but stored intracellularly. Therefore, this requires a special examination. And please, in case of acute viral infection, always think of high doses of L-lysine. L-lysine is an amino acid. It can also be given intravenously, but you can also take that, these 3,000 milligrams, 1,500 milligrams prophylactically, but please increase to 3,000 milligrams if you are ill. Most often, the L-lysine is encapsulated in 500 milligrams. It has a very strong effect with the arginine, and this arginine is needed so that the viruses participate, and that is exactly where it counteracts them. This means that herpes viruses, or viruses in general, cannot multiply. That's actually the most important thing we know. L-arginine is also involved in carnitine synthesis. We need this for our energy metabolism, but also for bone metabolism for the absorption of calcium. I want to leave it at that for today, and I hope I was able to give you some answers to your query. Keep fit this time of year. Your immune system, and it has nothing to do with just supplementing with zinc, L-lysine and vitamin C, but also to face life with a certain resistance. And finally, simply, sauna is the method of choice, but also cold chamber, please. A series of 10 times 2 to 3 minutes in the cold chamber is an incredibly great activity for our immune system because the body provides an incredible amount of activity against this cold stimulus. And not everyone has the opportunity to go ice bathing, even in winter. But there are quiet processes that you can do with yourself, but incredibly effective in fighting, not against something, but keeping the body fit, so that it is resistant to everything. Thank you very much. I'm already looking forward to next week and wish you a wonderful day or evening whenever you're watching this. Goodbye.